because it kind of encapsulates what an advocate is. So if it's bad enough when you're healthy, but when you're tired or sick or have a condition or a disease and you're navigating the US healthcare system, I don't know how it is in India, but as of right now, when we're talking about the US healthcare system, it is impossible to navigate alone. And it's not just from the actual healthcare, interaction with the healthcare provider, but it's everything from insurance to long-term care to rehab to, medication. I mean, we're living in I sort of think it's treacherous waters around medicine right now because it's a business more than it's a health, like we really care about your health. And it worries me. And that's why I like to teach about having an advocate. And I know that when I was an advocate for my parents, I was able to keep things more organized, both for me, but more for them as well. And making sure that appointments weren't missed and, labs that were needed to be done were done. And just sort of the whole picture of making sure I was, if you're not in a healthcare system, like a hospital or a healthcare system where you can have all your doctors talking to each other, then somebody needs to be a champion. Somebody needs to be the leader of the pack, right? And has to really oversee things. And there's usually not a doctor that wants to take that on. So you can take that on as their advocate. Okay. So this is and these are my words, but a health advocate's role is to assist, educate, and support patients and their families to make appropriate healthcare decisions for their specific situation. And I can add in to make appropriate decisions about many things in life, about wills, about general insurance, about next best steps for living, all these things is what really an advocate's role is. We advocate for our children forever. Once you become a mother or father, but the moms especially, you advocate. You are always their champion. You're the first one in the classroom saying they're not, getting enough, or you're the first one on the soccer field saying, why didn't my kid get to play more? So for some reason, as we get older, we tend to, I don't know why, we tend to still advocate for our children, but we forget that we have to advocate for a friend or our elders. And I think about that a lot because I still, even though my children are, in their late 20s and pretty much independent and launched, I still advocate for them, right? It comes along with being a mother. Okay, so this is just a slide that, sometimes health advocates can help, as I said, in elder care, care around a situation if you're needing more support, or insurance, legal, administration, all those things, as I mentioned. There is absolutely a very strong positive correlation between having someone in your life that is an advocate for you and better outcomes we'll just stick with health for right now, but whether it's medication compliance or making sure you are seeing your doctors when they want you to, following up with appointments and or, scans or blood work or whatever that particular healthcare provider is telling you they'd like you to do in reference to the specific topic you're talking to them about that day. There's 100% relationship of so much more compliance if someone else is there to say, hey, did you take your vitamins today? Did you remember that you need to go to the doctor on this, and this day? Accountability is what an advocate helps you be, or what you help someone else be if you're the advocate. And we tend to do better. We're a accountability conscious society. Yes, Bina.
I have to ask that if I get some health advocate, will they charge something as for monthly or time to time?
So that's a really great question. And I am going to get to that in a little bit when I talk about how to find an advocate if you don't have someone that's like in your family or a friend, and how advocates work in a hospital setting versus just in a clinic setting. So we'll get there. So I just said this, that advocates, when a patient has an advocate, they become more compliant. Okay. All right, so now I'm going to just stop sharing this because I really just want to talk to you. So advocates are the following. They are trustworthy. They are someone that you know and knows you, or that you will get to know and knows you. They are caring and they are available. Advocates are not always a family member. They are not all generally a provider in the patient's, in the healthcare provider's office. You have to be careful. Like, generally, advocates are not your, if there's any religious affiliation, advocates are not generally whoever you're, whatever you believe in, whatever that person is to you. Advocates are someone that you feel safe, close, and can be reliable. And they must have your best interest at hand. And that's why very often children become advocates for their parents, because they generally have, the highest risk, they're the ones that care the most about their parents. That's not to say, oh, Marianne was cute. It's not
In
to
a
say,
way, it is their duty also to look after their parents, because who one else will come to look after when you have your own children. But if they are far away somewhere in America or somewhere in a other country, that time a health advocate is important.
all right. And so I'm going to tell you in a little bit how to find that advocate, that person. Marianne had, she just popped in the chat and just said that she was here. She lives in Middlebury. Oh my gosh, Middlebury is gorgeous. And she's 67 and she's happy to be here and learn about this. So I hear exactly what you're saying. It not only happens, Bina, if someone is in a different country, but even if family members, children, whatever, are in another state. So I frequently like to begin to talk about how you find an advocate by just looking at your social circle, looking at people that you have known through the years and seeing if there's anyone that you really feel connected to in a way that you could say, hey, you know what? I have an appointment with this doctor, and I really would like you to be there. There is so much to say for a second person being in a room